Oke. I have done my BSc, MSc and PhD from Srimati Nathibai Damotar Thakursi University, that is Leelabai Thakursi College of Nursing. I have also done my postgraduate diploma in education management. I have around 4 to 5 years of clinical experience in various reputed hospitals like Hinduja, Kambalai Hospital and Lilavati Hospital. I have worked in US for 2 years as an education coordinator, and in Somaiya I have been here from 2012, initially as a vice principal and then was promoted to a principal's post. So in education I have around 20 years of experience. Nursing is considered as 3H. The 3H are head, heart and hand. Head refers to the knowledge. Heart refers to the love and the affection that is expected. And the hand, we are referring to the skill. So I think no program will become effective if you have a culmination of all these three. And the IPC modules which were prepared by ECHO had a culmination of all this. The theoretical aspect was covered, but along with it, there were practical aspects which required to be demonstrated to ensure that every nurse follows their steps and has received those skills to see that they prevent infection from any sort. So there were videos which were shown of certain procedures which were not being able to actually demonstrate. Along with it, there were actual demonstrations which were shown for hand washing. So this made it possible for all the nurses who were participating in these modules to see that the refreshment of that knowledge or the refreshing of that knowledge was done, because they were also made to do it along with the speaker who was teaching them. So this culmination of both theory and practice was there in this IPC modules which was there. The IPC training program and the curriculum that ECHO has designed, I think was one of its kind. I will say that it was one of its kind because though it was only around 10 to 12 modules, it had all the components which are required for preparation of a nurse from infection prevention point of view. It included the basics from hand hygiene till what has to be done in special situations, and also it covered aspects related to the latest pandemic that we had developed, that is in COVID. So I think it was a very comprehensive curriculum, and it involved a lot of hands-on training also, because there were discussions which were held. Interaction was a major part of that curriculum, and that made it two-way, though it was there online. So I think it is really great that this curriculum was prepared thinking about all the perspectives which go into infection prevention. I think one barrier that as educators we have faced during this pandemic is there a two-way interaction? But ECHO saw to it that it became two-way. How it became two-way was, one thing was, there were always questions which were engaged by the speakers themselves, where they saw to it that the participants answer. The other also is the participants, whether they were listening. So always at the end of the session, there was time which was given where the doubts were clarified, questions were encouraged, and also there was a pre-test and post-test which was a part of each module, wherein they saw whether there is active listening taking place. So it is not only the interactions which were encouraged, but also whether that program or that module has been effective through the questions which were there. So I think it was a team that made it possible that online sessions were made interactive. When we are taking nursing nursing involves 3H, that is attitude, skill and knowledge. This IPC program saw to it that it is not only theory, because as nurses we have to use our hands to see that we follow infection prevention, and that's why there were demonstrations even of hand washing which were also shown during the program. The another aspect was there were also certain videos which were there. So certain procedures which may have been little complicated, there were videos also which were shown which made the demonstration showing easier. So it was a culmination of both the knowledge and skill which was a part of this curriculum. Continuing nursing education is always necessary because there is change in the society, change in technology, change in the way we do any procedures. So ECHO model is one way to go forward because it will ensure the newest and latest recommendations which are there are broadcasted or disseminated to a large population at one go. Another thing is when we say that this model is used, we will make the nurses more stronger and effective because they will be able to see the guidelines which they did not know, maybe because it has not reached them. So I think ECHO model is a good way of dissemination and empowering nurses if we want to cover the entire population in a short period of time. I think I am in love with the motto that they are having, that moving knowledge and not people. So I think just keep going and doing that motto, and I would just like to say that all the best. It is a good team effort that you all are doing, and we are learning a lot from this ECHO model, and I think it's a good chance for us nurses to show what we are by making a change, and ECHO is helping us to do it. So thanks a lot to ECHO. So keep moving forward, and without moving us, you are spreading knowledge. So I think it's a great way for success. Thank you.